So what is a ureteral stent? Before we go into that, first we have to know what is the ureter. The ureter is actually a muscular tube that connects the kidney to the bladder. And the stent is actually placed within this ureter. And why do we do that? Actually, is to hold the ureter open to allow for drainage of urine. This is required when we need to overcome obstruction, which can be due to stones, tumor, or strictures. Sometimes we also put this post procedure to protect the ureter. However, the ureteral stent is actually a foreign body. Therefore, it should only be temporary within the body. Commonly, we usually put it in 2 weeks to 6 weeks. Some of the considerations that we have to think about in terms of the ureteral stent is the complications. So ureteral stents can cause pain. They can also cause irritation. They also can cause infection, and if placed long enough, they have encrustations, which make things complicated when we want to remove the stent. Other things that we consider about is also migration of the stent, which makes its removal difficult. However, in today's topic that I'm sharing, the focus actually is on the forgotten stent. Stents that are placed there longer than they should. And actually, when we define it, usually it's more than 6 months when they've been in the body. Next. So how big is this market? Actually, it's not that big. It's about $500 million a year. And at Tan Tock Seng, we put in about 1,000 stents a year. Globally, 5% of these stents are actually forgotten. And although stent is actually cheap, about $40 to $80, they have severe medical legal significance if they are forgotten. So in the UK, this is actually the most common successful negligence claims against doctors, the forgotten stent. And in addition, if we do forget the stent, the cost to the patient actually is quite high in comparison. The patient may need another extra 2 to 3 additional procedures to remove the stent, because this is usually due to the encrustations, and they need like lithotripsy to remove the stent further on. Next. So what are the current approaches that we have for dealing with forgotten stents? Some institutions in Singapore, they're using the paper card registry. However, this actually depends on humans, so there's a room for human error, because if we do forget to update it properly, as many as 25 to 30% of patients actually may suffer. At Tan Tock Seng, we use electronic patient registry in combination with emails. And even then, we have like up to 20% incomplete entries into this registry. Recently, Boston Scientific actually came out with an app-based registry, and studies have shown that they have lost about 1 out of 200 stents in the Turkish study. However, there are certain limitations to note. This only applies for Boston ureteric stent, and also in addition, we can't use it for other stents. And also, this so-called 0.5% is only because these are patients who already we have remembered to use the app for. Next. So what are the things that we have in progress when dealing with forgotten stents? One way is to let the stent degrade by itself, so therefore we remove the need to remember them. So while this is an exciting field, we are still actually experimental. Most of them are still at animal studies. The only commercially available product is a temporary ureteral drainage stent by Boston. However, this product has been withdrawn because previously it resulted in 4.7% of the patients having retained fragments. So next. So what are the possibilities? I mean, personally, I believe that this is a simple problem with severe consequences, but we can come up with perhaps simple solutions that are cost effective. I mean, just top of the mind, I was thinking about things like having something that emits a dye that colors the urine after a certain time, so that the patient realizes that he should see the doctor in case that he's forgotten that he has a stent within his body. Other things like alarm or signals. And the other approach perhaps will be looking at a systems basis, a robust automated system that removes the room for human error. Yeah, thank you.